Hey, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you about a pretty common problem: headaches. What a bummer. First of all, let me tell you, I am a migraine sufferer. So, I've suffered with headaches since I was a child. I'm also a headache specialist. I'm a neurologist, and I also own Urgent Care 24/7, a national urgent care company. But my first job was actually as a neurologist, child and adult neurologist, and headache specialist. So this is a topic I do know a little bit about. So personally, I know a good bit about headaches because my mom is a migraine sufferer, and I'm a migraine sufferer, and my son Jake, who's my sound and video guy here, he's a migraine sufferer. And that's because migraine vascular headache syndromes are can be passed down genetically. But I want to talk to you about just some basic headache categories if you're wrestling with headaches, so you can be a better informed patient and make better decisions about what you need to do to get relief from your headaches. Now, this is not meant to be a comprehensive topic. Actually, I can give a couple hour lecture on each type of these headaches. No fooling. But I want to give you just a quick overview of the different types of headaches so you can try to classify which headache you think you may have, and hopefully that'll help you seek the best care and the best treatment for your problem. So, in general, there's several different types of headaches. Number one is the tension headache, which is a muscular tension headache, typically described in a hatband distribution of pain, where the patient will feel tightness and tension both anteriorly and posteriorly in a hatband distribution, as I mentioned. That's the most common headache, and anti-inflammatories and analgesics like acetaminophen and ibuprofen are typically, and naproxen sodium are typically very effective for tension headaches. And there's a whole gamut of very mild to very severe tension headaches. I've seen tension headache patients that were intractable, that required centrally acting muscle relaxers literally to help relax these muscles. So just because it's a tension headache doesn't mean that it's a mild headache. The other classification of headaches are the vascular headaches. These are headaches that are not tension related. They're actually fall into that migraine category, this vascular headache syndrome wastebasket, which can include cluster headaches. It can include migraine headaches. And so these vascular headache syndromes that are associated, like migraine, are related to nerve and blood vessel interactions, where there's a pain syndrome where the blood vessels and the nerves both are improperly triggered, excessively triggered, causing what can be an amazingly intractable chronic pain syndrome. And then there are headaches that can be related to post-trauma, which are thought to be of a vascular origin, where after a concussion or major head injury, there's a spasticity of the blood vessels and the nerves of the brain, where the brain is somewhat kind of potentiated to hurt. Though I'm a firm believer that in all the headache syndromes, we actually learn how to hurt. Like in other chronic pain syndromes, our bodies get good at what we do a lot of. So I tell people, if you want to learn how to be a really good basketball free throw shooter, you need to shoot 10,000 free throw shots. And you'll get pretty good at it. Well, unfortunately, with our bodies, the more our body does something, the better we get at it. And that includes pain. So if you hurt a lot, we're not talking about an episodic headache, but an ongoing headache. It can kind of feed on itself, and it can become more of a chronic pain syndrome or chronic headache syndrome. And what can be an acute headache, like a tension headache or a vascular headache like a migraine, can transform into a chronic daily headache syndrome, where your body gets used to hurting and it just becomes part of your daily routine. Those are very difficult cases to treat. Extremely important that they get treated by someone who knows and understands headaches and knows how to treat them very effectively, such as a neurologist, and get you the help you need, because the longer you go down that path, it can be more difficult to break that cycle of chronic daily headache. The other headache syndrome that I want to discuss briefly is the mixed headache syndrome, which is a tension and vascular headache, which the truth be known, that's what most people have, is a mixed headache syndrome. But so it'd be a combination of the hatband distribution and the vascular headache, migraine, or a cluster headache, pain behind the eye, etc. Now, the other headache that I want to mention, there's actually a couple of them that are fortunately more rare, but can really be part of a very serious headache syndrome, is number one, if you have an acute onset, meaning rapid onset, bam, absolute, like a gun goes off, bam, worst headache of your life. That can be an aneurysm rupture, and it's extremely important. If you have an acute onset of the worst headache of your life, it's very important that you go get treatment for that immediately. That needs to be treated as a medical emergency, and literally dialing 911 and get to the emergency room immediately. Another headache that I do want to point out is a headache that's accompanied by fever and an ongoing illness, stiff neck, changes in vision. Those kinds of headaches can be related to a brain infection, either bacterial or viral brain infections, and meningitis, encephalitis. So if you have a stiff neck, if you have fever, and you have other constitutional symptoms, sinusitis, upper respiratory infections, etc., any infections of the head and neck or face, especially around the eye and around the nose and mouth, incredibly important that you go get seen immediately by a healthcare provider who is trained to diagnose and treat and recognize life-threatening headache syndromes, which again are fortunately rare, but very important. If you think you could have that you seek medical attention immediately. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe, and when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.